So first of all, I just want to thank my knowledge keeper, Norma, for the prayer and opening us up in a good way. For those of you that are not familiar with Métis gatherings, we tend to open our gatherings and meetings in a good way. And Norma always does such a great job, I think, speaking to partnerships, you know, and the need to create inclusive spaces it just hits kind of the heart of my presentation. And I do see AHS as a valuable partner for Métis folks in Alberta because we do access service delivery through Alberta Health Services. So thank you, Norma, and thank you to every single one of you who is with us today. I'm just going to start my screen share now. So give me just a second here. And I'm going to look, Nadine, if you can just give me a thumbs up if you can see my slides there. Perfect. Okay, so I'm really grateful to be invited. I think that the M&A has a lot, especially my department in the health department has a lot to be proud of. The M&A is a leader in Métis health research, and our research does focus on highlighting the unique strengths, resiliency, and health priorities of our Métis citizens. So I think it's really important to note that those priorities are not coming from me. Those priorities are coming from community engagement opportunities, anecdotal community phone calls, which happens quite regularly. And so that's how we determine the priorities and the direction that the Métis Nation Health Department takes, and how we reach out to Alberta Health Services to try to achieve, you know, improved health outcomes or decrease barriers in any of the ways that Métis Albertans have tasked us with. I think it's really important to note that through our reports, which are all available online, our engagement sessions, and our various research agreements with partners across the province and across Canada, we really are hoping that Métis voices and experiences will be heard. And I think this is a really crucial component of that self-governance piece related to health. I think if we say it another way, our health department, supported by our leadership, are really exercising the inherent rights that Métis people have to have a say in their own health. So for those not familiar with what the M&A Health Department does or who we are, we typically have two pillars within our department. So one is really focused on research. This is the most robust pillar as our department is entirely grant funded. And the current grant system does have more in the way of research grant opportunities than actual programs and services. It falls into major domains that Métis Albertans have indicated are priorities for them. So that includes maternal child health, cancer, chronic disease, and surveillance, as well as mental health and well-being. Within our community wellness portfolio, this is where we move our research into action. So when we hear that there are barriers, or when we hear that there's things that make us well, you know, a strength-based approach, we try to roll that into our community wellness pillar. And so we have multiple programs and services that reside there. But currently we have a health program administrator, a community wellness advocate, and a community prevention practitioner. So this is just a quick slide that shows you a few of the things that are going on within our community wellness pillar. So currently our community prevention practitioner provides culturally appropriate tobacco reduction or cessation supports. And I want to just call out partners in this slide because we've aligned ourselves with AHS, who has graciously supported us in adapting the current Alberta Quit Core into a more appropriate, slide deck, even incorporating AHS pharmacists to come and talk to our community. So yeah, that's a really great program. We have our medically necessary accommodations. So for any of the navigators on, on the presentation today, if you call the M&A for folks who are traveling to, meet a specialist within our centralized services in Edmonton, you can phone us and we have apartments in the city and we can put folks up in them to support them and decrease those transportation barriers. Our community wellness advocate has not launched yet. We're in our development phase, but that's targeted on supporting and advocating specifically for mental health within our Métis community. We have opioid and naloxone modules, which we've just finished transitioning online. Formerly, prior to the pandemic, we were going community to community. We delivered more than 3,000 naloxone kits to more than 170 communities across the province of Alberta, and provided, I would say, that training in a very culturally safe way, using using language that our community uses, and really without judgment or stigma. And so we're really proud of the accomplishments that we've had there. A lot of that obviously put on hold because of the pandemic. We're gearing up to make that a success once again. We also have our cancer transportation programs. So for folks who are traveling, to our major cancer centers like Edmonton, we're able to provide mileage support. It's a moderate allowance, but definitely we can help decrease barriers to get to those much needed appointments. We also have a partnership with the University of Alberta that provides some dental supports to our community. And I'm really proud of the M&A wellness program. So for those of you who may be in social work or other navigator or advocacy for Métis folks within your current roles, all M&A citizens are automatically able to access 12 hours of free goal-oriented counseling supports through our partnership with Alberta Blue Cross and Homewood Health. And so that's, we heard from community that mental health during the pandemic was suffering. They just wanted to have access, and cost was a barrier. So we've taken that away, and we have trauma-informed counselors that are able to provide that short-term goal-oriented counseling support just to get us through. So I think that's a program that I'm incredibly proud of. All the information and eligibility criteria for current programs and services are found on our Alberta Métis website. So the email will be provided at the end of the slide deck, but you can also just Google the M&A and that will pop up and you can find all of those programs online. I should caveat, if it's a resource scarce program, typically you do require folks to have citizenship with the M&A, but not always. So just counsel your folks if you are referring them to just check the eligibility criteria. And we're always happy to help folks apply to be citizens of the Métis Nation if that's something that interests them, but we definitely don't need to push that. It's just sometimes a program requirement. I would be remiss before I dive right in. I just want to, really thank my team. For those of you, you may have come in contact with some of these folks in the areas that you have in your own work, but definitely want it on record that these are the doers. These are the people that make it happen. So I'm so grateful for each and every one of them. And I hope you have a chance to connect with them in your daily work because that means you're reaching out to the M&A to support Métis citizens. So what I'm going to do today is just a quick high-level overview of Misi Yehewin, which is big breath. It's really understanding the COVID experiences and perceptions among Métis Albertans, and it is just preliminary. So I want to acknowledge, that Dr. Maria Ospina is our research partner and academic partner in this work, and she's been a absolute ally, friend and partner to the Métis Nation for many years. So she's not here today, so I hope that I can do her justice. While this may not seem maybe particularly relevant to each and every one of you, I really want to challenge you to position yourselves in your own roles as you listen to this preliminary results that I'm sharing, because it may seem incredibly health focused or maybe too researchy, but what I want you to think about is the key themes that come out of this information, because there are definitely lessons to be learned, and it's not my lessons. I'm a megaphone for Métis community, so I'm sharing what they have told us. So today I'm going to talk a little bit about the COVID-19 experience. We'll set the stage just by discussing a brief overview of the impact that COVID has had on the citizens of the Métis Nation before we move into a preliminary look about what community has so graciously shared. And we'll conclude that presentation with a discussion of potential future directions. So before we dive in, I want to sincerely thank the more than 1,500 Métis Albertans who did share their experiences with us. Merci for sharing your knowledge. It means a lot. And the fact that we had 1,500 people access a survey that was only open for a month speaks to the fact that Métis Albertans wanted to be heard on this topic. And so validates the need for this work. I also want to acknowledge the team who worked to develop and navigate, validate and analyze this comprehensive survey. It really is, Norma spoke to genuine partnerships, and it really is hard to find those these days. And I think that this partnership is truly one. So thank you to each and every one of them, and just our funders, the Public Health Agency of Canada. So I'm not really here today to provide a history lesson about the Métis. There are certainly many places to gain this information and have an understanding of that history and culture. And I really do encourage all of you attending today to seek out those places and spaces that offer those lessons. I think that's just part of the ongoing decolonization process and commitment to reconciliation, to be honest. What I do feel is important prior to presenting our preliminary findings is that it's really crucial when we're speaking of Métis people that we honor the fact that Métis people are strong and resilient. We're one of 3 distinct Indigenous peoples of Canada. Our culture did originate post-contact from the union of European fur traders and First Nations women in the 1700s. And really the descendants of those marriages formed a distinct culture, collective consciousness, and nationhood in the Northwest. And I think there's a common misconception that, anybody who has half First Nations background and half European descent suddenly becomes Métis, and that's not the case. The Métis had a distinct homeland in the Red River, and it was in this homeland that the unique culture, laws, languages, and traditions of the Métis people were built. And I think that many of the past and present challenges of the Métis are a direct result of the erasure and invisibility of Métis people, their history, and their identity. So I think Métis experiences of colonization have really created and maintained some of the same traumas as First Nations and Inuit people. It's important to note, especially in this time, where we're all digesting that, the trauma that Indigenous people did know, about residential schools and 60 scoops. Métis people were not excluded from those horrific colonial practices. It's also, important to note that Métis folks were dispossessed of their land as well through colonization. So why am I even giving this brief history lesson? I think despite the ongoing horrors of colonization, and I know that, sometimes that can make you feel icky just using that word, I really want people to recognize that Métis are strong and are resilient. And it's important, especially in times like these where a pandemic has a potential to create a narrative, that we remember while I'm presenting challenges voiced by Métis Albertans, that it doesn't define who Métis people are as a people. Just because you're facing a challenge does not mean you're marginalized, does not mean you're vulnerable. So think of Métis people as they wish to be thought of, as a strong, vibrant, and unique culture as I present these. So you guys are probably all familiar with these since we have a lot of AHS folks on the line. So you've probably seen aggregate data for the rest of the province. This happens to be specifically the data for the Métis Nation of Alberta. So through our information sharing agreement with the province, we're able to get Métis specific data related to COVID-19. So this is a little bit dated because I haven't had a chance to update, I apologize, but as of May 26th of this year, we've had 3,210 cases, active cases of COVID-19 amongst our community, a majority of which are occurring in the Edmonton zone. We've had about 31% of unknown exposures, which makes it really hard as a health director and collaborative partner with our province's public health, because we don't know where those cases are coming from. Sadly, we know that, that's roughly 3% of our registered citizen population. So it definitely is having an impact. You can also see that, unfortunately, we've had 14 deaths amongst our community. And what you really need to understand about Métis folks is that a single death has a ripple effect across the community that values community connections, culture and kinship ties as one of the most important social determinants of health. So those 14 deaths have a significant impact. But this data also outlines a need for the work that we're doing, right? So when we do research at the Métis Nation, it's not for the sake of research. There needs to be a reason, because we don't want to burden our community. But we're missing stories. We have concerning data, and then community reached out and said, we want to know more. So that's the reason why we're doing this study. We definitely adhere, and I'm going to blow through this because we have a short period of time today, but we do adhere to the principles of Métis ethical health research. And for those of you that are working in any space with Indigenous people, you need to look this up. I mean, NAHO, the National Center, National Aboriginal Health Organization is no more, but this document still exists online. And I think that understanding the concept of reciprocal relationships, respect for safe and inclusive environments, diversity, and the Métis context, all of those pieces are really important beyond research. Those should be implemented into any program or service that anybody is offering to Métis Albertans. And if you really think about it, that Métis way of being is actually good for the broader society. So you don't have to be Métis to benefit from having programs that address these components. I just want to say that we, to the best of our knowledge, this is the first study in Canada that does provide a comprehensive evaluation of the health and well-being outcomes of Métis folks during the COVID-19 pandemic. And the goals of this study are to look at a longitudinal trajectory of physical and mental health during the COVID-19 pandemic. We wanted to explore what Métis people actually, felt and experienced about the impact of COVID-19 and public health orders, because we know whenever we impact a restriction, there's probably going to be, an outcome related to that. So what are those on the physical, mental health, behavior, cultural expressions, and community and family support? So the study design is kind of meant to happen in 3 waves, and we've completed the first wave and the second wave. The third wave, actually, we're shifting. Community has said they don't like to be engaged during the summer months, so we'll shift to the fall. However, this information that I'm presenting today is focused on the December and January survey. We connected with Métis citizens and non-Métis, so self-identified Métis within Alberta during the COVID-19 pandemic, and anyone who was 16 years or older. The M&A does a great job of engaging their own communities. So we have, tried and true methods that includes, emailing, social media, and other promotional activities within our regional offices. I'm not going to read everything to you, but you can see that we had comprehensive domains. So we didn't just ask specifically about, how to go with COVID. We asked everything from like, are you struggling financially? Are your kids being less active? All of those things that we probably had assumptions about, but wanted to have validation from community. The survey instrument, I think it's really important to note, even though we had an academic partner to convey best practices, the final say and validation of that survey comes from within the M&A. And so we do pilot those things and make sure that the survey is put together in a way that isn't going to harm our community. This is just an example of, we have data sovereignty. We're storing it on a secure server, but the people that have access to that and the ownership over that data does belong to the Métis Nation of Alberta on behalf of its citizens. So I'm getting into the meat and potatoes now. Community response to this survey was actually really overwhelming, and I really do think it validated the need for this work. So we had more than 1,500 people complete this survey. We had about 318, that were incomplete, and that doesn't mean they didn't answer any of the questions. It means that they chose to leave some questions blank. Most of them identified, so 99.1% identified themselves as Métis Albertans, and actually 98% of those were members or citizens of the Métis Nation of Alberta. The gender identity, it was really great to see, that we had, a variety of gender identities, and we did provide, a diversity of options there. So I think it's really great to note that the M&A is working to be as inclusive as we can. And I think that's worth highlighting because we do have a fairly conservative community, and that's something AHS partners need to recognize. But we do have a diversity of gender identities within Métis folks, and so we need to respect and honor that as well. In terms of socioeconomic characteristics. So a majority of the respondents indicated they were in a relationship, while about 30% indicated they were single at the time that the data was gathered, which is important for a time during the pandemic, because those folks, that 30% that indicated they were single, for a community that, values social connection, kinship, and community ties, those are the folks that I'm probably most worried about, right? Because we know that that's such a strong determinant of health. Of those that responded, about 43% indicated that they'd completed a college or university degree, with almost 10% completing a graduate or professional degree. And I think this is really important to highlight, especially within organizations like AHS. There are stereotypes that exist in the broader public that Indigenous people don't necessarily have the educational knowledge or capacity to understand anything. This tells you otherwise. We have many well-educated folks within our community, so that you can see how those assumptions can make things harmful. But we do need to recognize that we still do have 1.4% of the folks that took this survey that had primary elementary school or less. So when you're creating the programs, you need to recognize that there's a diversity of educational levels within our community. We know that social economic status is an important determinant of health. And within those that responded, we note, the following household incomes. And I think that it's really important to note that this doesn't take into consideration, this particular report, the number of things like household dependence and such in this preliminary description. We're going to unpack it later on. So I think there's room to unpack that. I do want to note that, we see that there is 3.6%, that have an income less than $10,000 that they're surviving on. And I want to be very clear that this is not because they are Métis. Okay, I'm really cautious in presenting data like this, where it could have the potential to create a narrative that it is because they're Métis that they're not, making it socioeconomic, and that is not the case. So I just want to be very clear. This kind of confirms what we already knew, that the majority of Métis folks are living in our major urban centers. It also shows that we had a pretty decent sampling that aligns well with our registration data to show that, from the top of the province to the bottom, we had folks participating in this survey. Most of the community members, resided in a home that they either owned or rented, but we did have 10% of our community that answered that they were living with other family members. So when you think of that in the context of the pandemic, that can mean increased utility bills, increased need for supports and services, as older children are moving home with their parents who may be on fixed incomes. So we also, almost half of those who answered had children at home, and of those, 26% had children under the age of 4. Now think about those Métis folks coming to it within AHS, for any sort of supports or services. Are you supportive of a family approach to care? Because guess what? Those children under the age of 4 are going to need to come along with mom and dad sometimes. So, I challenge you in the positions that you occupy. How are you making space for the third of the Métis Albertans that definitely have dependents that need to come along with them? So I'm just going to kind of trickle through this. This is the interesting stuff that we're getting into. So we talked specifically about COVID, and don't worry if you're getting panicked. I'm not going through all 69 domains that are surveyed, just a few. We did have about 96% of our community indicated at the time of the survey that they really hadn't had COVID. But what I'm interested in is the almost 60% that did not seek medical advice related to COVID. And I'm curious as to whether or not that's because the MNA and Alberta Health Services and the province did a great job of conveying, check your symptoms and you can stay at home unless X, Y, and Z happens, or if this is actually in alignment with what we already know, that Métis Albertans actually have a lower attachment rate to primary care physicians than the general Alberta population. So this could be worrisome, or it could be a success in our communication, and we're analyzing that based on the other questions that we have in our survey. The other thing that's, sorry, I'll go back one slide. The other thing that's interesting and validating for Alberta Health Services is that they did actually have a large number of our citizens that actually phoned Alberta HealthLink. So when we talk about the diversity, you can see that we had, a small percentage of folks that just chose to talk to community members or with traditional Indigenous healers, but we also had a larger percentage that actually accessed mainstream services, which indicates that we need to do a really great job at making sure the people who are answering those phones at HealthLink have an understanding of who the Métis people are and what their needs are. Because if we don't, we're letting down 15% of the population. So we really need to think about that. And those are the themes that I'm talking about. You can see where, you can implement interventions that could have a meaningful difference that are really not that hard. Most of our community, we had about a 50-50 split of folks saying they tried to get tested for COVID. Most of them were negative, which is great. Most of the community felt that they were treated in a respectful manner during the COVID testing, but it's that 3% that I wanted to know more about. Most of the folks told us that the reason they were getting tested for COVID was because they either had symptoms or had close contact. But I'd like to draw your attention to the almost 10% that said they were just worried and wanted peace of mind. So those are the kinds of things that, if they are contacting HealthLink, perhaps, HealthLink has a great role to play in, alleviating that worry or creating that peace of mind. So something to know. It's really important for my role, to really understand the experiences. And I kind of do like to think of myself as an amplifier or a megaphone for the voices of community. And so we actually asked for a little bit more context because as much as the numbers have meaning, they don't tell the context. They don't tell the actual story. Okay. And so we actually provided open-ended questions for each of the domains where Métis Albertans were invited to share with us anything and everything that they wanted us to hear about that particular domain. And to be honest, I actually had to go back and do a full qualitative analysis because the overwhelming response from community was just ridiculous. So I'm going to share a few things that I think are relevant to you. So when we talk about, that 3% that said they had a bad experience with COVID testing, and I think this can be applied broader, not just COVID testing, but experiences within a health system. Some folks felt that they were mistreated. So they felt like they were cattle being herded through hordes of sick people. Staff was cold, lacked compassion for how anxious I was feeling. So really understanding that. They felt rushed, like they were a number and not a person. They felt that there was poor organization at the sites. So they weren't disinfecting chairs. And they felt that if they were going to get sick, this was going to be the place it happened. Some folks had issues with test results because they never received a call with their results. They had to miss work, they waited, and they finally had to make an appointment. So maybe there's an educational knowledge gap on how to access those results through our provincial system. We also talked about experiences. So folks during COVID had challenges accessing other mainstream health services. And I know I'm preaching to the choir because you guys are the ones that had to absorb that overwhelming stress from, the province of Alberta as we dealt with COVID. But a quarter of the people that we surveyed said they couldn't get in to see their family doctor or their dentist. Really concerning, 11% of the folks that answered this question said they couldn't get into their mental health care supports. And that's really concerning. And obviously we have a smaller number down at the bottom with EMS and substance abuse. We talked to Métis Albertans of, how were you guys doing adopting, COVID-19 restrictions? So I found it was, most of the time or always, they said they were washing their hands and kind of doing the basic things. But where we ran into a little bit of concern was that folks said they didn't usually, or they very rarely self-quarantined after trip or because of COVID-19. And so that's a bit of an educational target for me over here, and certainly something I'm sharing with you because maybe it's an educational target for you guys as well. Of course, this preliminary data was before we actually even had approved vaccines, but we played the hypothetical game because I really needed not only myself, but the province and our health service providers to understand if we were going to have a vaccine, would Métis folks take it? Because if they said no, then we have a little bit of work to do to try to communicate the benefits and the risks and all the information that our highly educated population needs to know. Thankfully, a majority of our community understood the importance of the vaccine and said they'd roll up their sleeves on the date the survey finished. And so that was in January, right? However, there was still 26% of the folks that answered the question that we're not going to get COVID vaccination. And so again, I wanted to know why. Vaccine safety was a big theme. They didn't trust it. Too many questions, too many politics, and too many inconsistencies. Lots of people, it was made too quickly. So it's not that they were anti-vax, it was just this particular vaccine. So what we did with that was we made extra efforts to talk about the development process of vaccines to address this concern. Also, the mistrust of government. I don't think I need to go into the history of Indigenous peoples and the relationship that they have with all levels of government in Canada, but definitely that was a theme. And the need for more information. So again, if you just look at the numbers, you don't have the nuances from this. And I'm happy to share this because I think that, this can be applied to any area, any medication, even interventions within the health system, right? Ensuring that need for information, that mistrust, and is conveyed in the programs that you developed. This next slide, I think I wasn't shocked to see this, when we asked folks, if their overall quality of life had changed. I think I was trying to be optimistic and hopeful that we would be able to, people would say, no, we're about the same, or it's gotten better. But if you remember, I talk about the importance of, kinship and community ties to the Métis people. It's not that the other social determinants, are not important, and those were certainly impacted by the pandemic as well. But within our community, we haven't been able to gather for 2 years either. But that's something that, is deeply ingrained in our cultural way of being as well. And so unfortunately, about 70% of the people that answered this question said that their life had gotten worse as a result of the COVID-19 pandemic. Obviously we have open-ended information about the ways that people said we could help at the MNA to make it better. And, programs and services have rolled out of the MNA specifically targeting those responses. So we've had our child wellness benefit, we've had youth recreational benefits, we've had, programs trying to increase connectivity. So Chromebook initiatives so that, our elders can connect with their grandkids, or the kids can continue their schooling. So we're trying to target these things, but definitely it was across a broad spectrum. So just know that community coming into your health system is already feeling pretty low. And so I know you guys are too, as frontline health providers and folks that are working to support the frontline health providers, but just know that there's a community that's hurting, that's going to be entering your system with their needs post-pandemic. So I think it's really necessary to highlight that, the lived experiences and the perspectives of Métis Albertans is really critical. I don't think priorities, should ever be set by technical staff in a vacuum. And I think without those who graciously shared their information, it would be left for others, like myself or like AHS to determine those priorities. And let's be real, the results of setting priorities, outside Indigenous community hasn't really been great for Indigenous people. And so when stories are shared, it gives Métis Albertans a voice. It provides folks like me the context with which to advocate for and implement policies, programs, and services. So that was really jargony. And I really feel the need to call that out in a presentation. Obviously my training makes me jargony, but I think I really want to show you the power of Métis voices, the ways in which we truly do work to honor the voices of community, especially during this pandemic. So based on that information, that little nugget that I shared about testing experiences, and definitely the room to improve on those themes, we applied it to a similar area. Okay, and this is not a shameless plug for what I believe should be a model considered for all future vaccine clinics rolling out of Alberta Health and Alberta Health Services. What it is a direct reflection of action grounded in community voice. So community voices contributed to the efforts that ultimately led to the creation of this clinic. When we looked at the responses from Métis Albertans, it really helped us understand that our vaccine clinic could target some of those concerns around testing. We wanted to make sure people didn't feel like they were herded. We wanted people to feel like they were coming to a gathering and having a relationship with the staff that were there. We wanted folks, to be able to ask questions. And so we actually partnered with the Indigenous Wellness Corps and had physicians coming in every day to make sure that folks could ask questions directly in the moment about their health status related to the vaccine. If they wanted to explore side effects, they could have a side conversation directly on site and know that their question mattered. We had Métis folks, so community was there supporting community. We greeted folks on the way in. We respected and guided them throughout, and we thanked them and sent them on their way with a piece of, beloved traditional food, bannock and jam. And I think that it's important to see how surveys and community engagement, like, I'm presenting today, really does lead to action. And this is just based on very preliminary data. So I'm really excited to be able to share the broader report once that's completed. And I don't have a timeline yet because we're going to bundle it all together when we're finished, with our next wave in the fall. But also I want to highlight for those who are in policy, program, and service development with AHS or other organizations that may be listening in, this wasn't rocket science. This wasn't hard. I listened more than I talked when I developed this program. All I did was ask community what they needed. They told me, and it wasn't expensive. It wasn't hard to create, models like this. With that being said, I'm here. I'm here for you. My role is to support improvement of health outcomes for Métis Albertans. So if you need to hear what community offers as solutions in any of your program areas, you can always reach me. I mean, admittedly, my capacity as a health director during a pandemic means my email might not happen the same day, but I will always commit to getting back to you to see if there's some way that I can support you in supporting our people. So next steps obviously is wave 3 in the fall, but I'll just kind of, when that happens, it happens, and I'll make sure I share it with folks at AHS so that they can share survey links with any Métis patients that they may have in the various institutions. And I think that, I totally understand and respect that there's a diversity of opinions around COVID-19, and we're going to move into questions, I'm sure. And I would just ask, be mindful. I know this is a safer space because you guys are all frontline dealing with it, but recognize that, while you who are asking the question may not have been deeply impacted by the virus, others, on this presentation today might not be so fortunate. So just think about that when you're phrasing your questions today, but I don't think we're going to have many anti-vax or anti-COVID folks on this call. But in the case that you're there, just be kind when you're asking your questions. Marcy, I'm going to just end this. I think this is recorded, so you have my email there and you can go back and grab it if you need it, but I'll stop sharing and then we can take questions.
Thank you so much, Regan, for sharing that incredible presentation along with the incredible information that you shared and the work that's gone into this, and the study and the results, everything that was so interesting, and I know we can all learn a lot from that. So thank you so much for allowing us that opportunity to see the voices of our Métis citizens and the work that you're doing. Would like to open it up to if anyone has any questions, whether you want to throw it in the chat box or if you feel comfortable coming off mute, you're welcome to as well. Or if you have any comments in general that you wanted to share.
I'm going to put Carol on the spot. Carol, what did you think of the vaccine clinic? Because I know, not to out you, but I know you got an immunization because I took the photo. What did you think of the experience?
Oh my goodness, it was, I so appreciated, and Jamie Harmon, I think, is on here today. She'd gone the Saturday and then I'd gone the Sunday. Oh, there she is. And I saw her on the news and she says, it was like a Métis event. Okay, sorry, Jamie, I'm outing you. And it was like, and I went there thinking about that because I was expectant, right? And it was so nice to see people that I knew, and it was so nice to be there with community and chat from afar and try to figure out, who was behind those masks, and also there, for the group were people from our clinic as well. So we had physicians from the ARP clinic and nurses who'd worked in the clinic as well. So Keith King was there. The day I went, Dr. Peterson was there, and it really did feel like an event. Typical Métis, classy style. And I thought, yes, and as I was leaving, we had a picture with President Patra, and I grabbed my bannock and I'm thinking, I just missed this. I miss connecting. But it was amazing. And actually I'm scheduled to go back again on Friday for my second dose. And I've had many people the opportunity to go elsewhere, but I was missing that. So that's what I'm going to do on Friday.
I love that. And I think one of the other things I didn't really share is that at that clinic, I took an opportunity to ground the Alberta Health Service immunizers in why it was so important for, our community to have a Métis specific clinic. Just kind of what community had said was important to them. And we shared that with the immunizers that day. And at the end of the clinic, they said, I don't know why we don't do this for everybody, because the experience, of having a safe and welcoming immunization clinic is universal. And so I think that that's one of the things that, we often, and not we, society often tends to prioritize, certain Western ways of doing things over an Indigenous way of being, and they're not zero sum. They can come together and create this amazing space where two models work in harmony to create something even better. So I think that, that's another thing for AHS staff that are occupying spaces in policy and program development to think about, how do we bring those two worlds together to create something beautiful and safe, in our case for Métis Albertans. But we did have, First Nations folks and Inuit folks attend our clinic as well, because that way of being is really kind of universal. Just knowing that you're cared for is universal. And so we had staff from AHS convey that it was one of the best clinics that they worked at because they could feel it. And so, I challenge, those who are here that have the privilege of, power in their roles to think on that, because we can do better. We can do better together. And I think that, reflects back to our knowledge keeper Norma when she's talking about partnerships and how we create those spaces. It doesn't have to be hard. It doesn't have to be huge. We can start small. And that was a great example.
1,300 is pretty huge in my book, though. 1,301 was pretty huge in my book. So congratulations. That was amazing. And yeah.
And I see a question in the box. Is there a follow-up immunization clinic for second doses right now? And I'm actually going to drop, I'll go on my Google over here, and I'll get the link to our booking, because we actually are running a clinic this Friday, Saturday, and Sunday. And we are definitely welcoming, obviously, Métis Albertans, but also all Indigenous Albertans, and essentially family and friends. So, if you are already due for your second shot, you are certainly welcome to join us. If you haven't yet got your first shot, come on down. We're happy to have you. So anybody, and that includes your family and friends. So please feel free to share that link. We still have room on Saturday and Sunday. Friday's almost full, but we're happy to have you.
Thank you, Regan, for that additional information. There's a few additional questions. Just one, if you'd mind putting up the slide on your email contact again, if you can take a look for that and put it up. And then while you're doing that, another question, is there data being collected from those who have received their vaccine and reported side effects to share with the broader Métis community for those who have concerns with the vaccine?
Yeah, absolutely. That's a great question. So the answer is yes, not. So in survey data, we have asked for folks to convey their experiences with the vaccine. So we will eventually have, survey specific data for that. Through our Alberta Health Services, Alberta Health Information Sharing Agreement, I have access to, the same information that the provinces have, but linked to our citizenship registry. So I will eventually have information about that. But unfortunately, because they're so busy supporting the broader Alberta approach to the pandemic, it's likely that it'll be retrospective for me. So I won't get that in real time. However, I've been directing folks to the Public Health Agency of Canada, does put all of the known adverse events on their website and is really transparent. And it's actually, for a government website, it's really easily navigable. So we have shared that with community members who have asked. We have health professionals on site to answer those questions about side effects. So we're definitely not hiding any of that. And through we called it I mean, I think it's quite clever, but vaccination talks, we provided an opportunity for community members to ask those questions directly to both myself and other vaccine specialists who happen to be Métis as well. So we provided a number of avenues for people to ask that. Hopefully we'll have, great responses from community on the last survey, because that is where I'm going to be asking a little bit more in-depth question about side effects. So, if you are Métis and you are listening, definitely do the survey when it comes out end of August, beginning of September.
Thank you, Regan. Another question, again, thanking you for the amazing presentation and the rich responses and the way of the vaccine clinic. So definite kudos to that. The question is, what kind of follow-up is being done with unpacking the self-isolation slide in terms of those, or in terms of looking at barriers to self-isolating? There are many barriers due to being primary caregivers or other potential barriers.
So we definitely, in our more in-depth analysis, are unpacking potential barriers to isolation, and that includes, we do have folks in our community that are working essential jobs, so they don't have an option, because of their socioeconomic status. Maybe they're working a job that they absolutely can't afford to take sick time from for any of the reasons you've indicated, right? It's a privilege to be able to isolate, and so we are trying to understand that a little bit more, whether it's related to socioeconomic status, whether it's related to dependence at home, and those kinds of things. And that will enable us to advocate for, policies and funding to support those areas, whether it is, hey, are we arguing for a universal basic income? Are we arguing for, approved sick time for everybody? Those are the kinds of things that can flow out of that rich data. This is just a short, we had 69 domains and multiple survey questions. So this is just like a really quick high level overview, and I'm excited because it means when we finally get this report out, I'm going to have an audience. I know I will use it, but it sounds like there's lots of people who are interested. So, when we get that all together, I'll be happy to share that back with Alberta Health Services for sure.
Wonderful, thank you. And they said thank you for explaining that. That was really helpful. Any other questions or comments? Again, feel free to take yourself off mute.
Hi, I have a quick comment. I just want to say hello, Regan. So nice to see you. You look great, by the way. That was an excellent presentation. I really appreciate all of the information that you shared. I certainly learned a lot from what you were explaining, especially at the beginning with all the services that are available to our broader community, which is outstanding. Like, it's great to see that there's so much support. And again, really, I'm just sort of echoing what Nadine and Carol have already said, just again, about all the great information that's been shared. And I also just want to commend the Métis Nation for putting together those Métis specific clinics to try and sort of shatter some of those barriers, with vaccine hesitancy and whatnot. I know a lot of my extended family members did access the one that was put up in Lac La Biche. My youngest brother was able to attend there as well, was able to get his first dose. He was so happy to get his Bannock at the end of the day. And he said he was so happy that he got a shot that he did the Red River jig out the door. So he was quite happy.
Thanks for that. I was looking for him and I should have been able to pick him out because he's tall as anything, but I was probably engaged with the Red River jig in community myself. So, but yes, we had, I think one of the things we're learning is that the M&A and Indigenous community organizations in general have a role to play within the health system, and we're significantly underutilized. Sometimes all we need is an invitation. If you're having a health services fair at AHS, have you thought about reaching out to the M&A to come and support Métis Albertans? Have you thought about reaching out to, our Treaty 6, 7, and 8 friends, and our Inuit organizations? And I think those are things that are significantly underutilized now. So it's great to hear from you that, community accesses them because we have that trust, right? So yeah, definitely. If anybody's here on this call, that can hear Jesse saying like his family appreciated it, give us a call. We might not always be able to be there, but like right now, our phone is not ringing off the hook. So, if there are ways that we can support the broader health system to make it safe for, our community, give us a call for sure.
Yes, Perfectly well said, Regan. And Jesse, thank you for coming up off mic mute to share that really special message. Really appreciate that. Any other final? Oh, Christy?
Yeah, hi Regan. Thanks for your presentation. It was great. I really appreciate it. I had a question just in terms of the respondents. I noticed that it sort of seemed like there's twice as many folks who identified as female as compared to male in responding to this survey. So did you have any explanation as to why there was twice as many, and also how you I guess consider that context in the responses as well?
I mean, I have assumptions, and I haven't kind of gone through the gender analysis in depth yet with my academic partners. You know, but Métis women do tend to navigate a lot of the health services and systems and experiences on behalf of family members. So it's not that we're a completely matriarchal community, but you'll have heard, you know, like, of the strength of Métis women. And if you haven't, you should, because they are a force. And so I'm not surprised. We do tend to see Métis women being more engaged in the health related initiatives. And I don't know whether that's, you know, the terrible gender conformity where, you know, where we tend to think that men can just, you know, tough things out, and so they don't need to tell people how they're feeling, or not. I mean, I don't want to make assumptions. So we are looking at that, but it's not uncommon for us to see a larger number of women than men. You know, our registry data, our population pyramid, we're pretty split actually. There's a few more women than men who are citizens of the nation, but typically in engagement sessions we tend to see more women, and I don't know the answer, because we know that men are always welcome. We always do encourage our community, you know, and we're always excited when we see, you know, a third of the responses are coming from the male gender. I was actually just most excited to see folks feeling comfortable enough to identify as gender diverse, because historically within our community, you know, I think just because it tends to be a very, you know, Christian-based religion, there's a lot of, you know, if it's not traditional, it tends to be more Christian-centric, you know, and conservative, if I'm being honest. And so for community to feel safe enough to identify as gender diverse was kind of where my take-home message, because that just means finally, right? You know, I feel like we're reaching a point where we're doing it so that folks, you know, who identify different than the stereotype or the normal. I hate to use the word normal because it makes it othering to those. And I'm terrible at the gender language, so I apologize. It's not my area of specialty. But I think that recognition that the diversity is there was what I was most excited about. But it's a great question, and it's really nice to see you, but I can't see you again.
Thanks, Christy. So we may have time for one more call, one more question or comment. Just final call. Okay, hearing none. Just before we move to the closing prayer, just once again, thank you so much, Regan, for the incredibly informative presentation. Thank you all to the participants for joining. Again, Together for Health, tons of events going on this week and even more next week, all the way to the end of the month. So there's definitely been some updated presentations on there. So even if you've checked out, please go and check again. Some of the recordings, many of the recordings and presentations we now have up on the website. So if you've missed or only able to get a portion of it, feel free to go back and listen to the presentations of the recordings or check out the slides. And again, if you have a chance to fill out the survey, we encourage you to do that. We have weekly winners of donated beaded items, Indigenous blankets, and other little wonderful promos from the Indigenous Wellness course. So please continue to check out the site. So with that, very honored if I could turn it back to you, Norma, to close us off in a good way with a closing prayer.